to their health, no matter how bizarre or crazy it may seem. But some alternative therapies can put your health at serious risk. So today, I'm revealing which ones can help and which ones are just hype. The first extreme alternative therapy is for pain management. It's called cryogenic chamber therapy. Now, cryotherapy is the application of cold temperatures to all parts of our body. And it's something we've used for a long time, right? Many of you may have tried this high-tech version, right? An ice pack. But imagine if you could grow it. Right over here is a cryo sauna. It's got liquid nitrogen that's released into the chamber to cool down the body and reduce the inflammation and the pain. So, audience, what do you think? Does it help, or is it just hype? Get out your answer. Oh, they are split. They are split. All right. The answer, it helps. These new expanded forms of cold therapy can be very helpful for folks who have debilitating pain and inflammation. And let me show you why. Here's an animation of what happens when you have pain and why cooling it makes a difference. So let's say you're exercising and you sprain your knee. Right? You've got aches and pains inside of that knee, and what ends up happening when you have a eroded surface is the blood vessels over the painful limb begin to swell. And as those vessels swell a little bit, they'll release chemicals, and the tissue underneath next to it get influenced by these white blood cells that sneak across and release chemicals that cause inflammation, irritation, and almost a scratchy feeling. Now, that swelling can be addressed if you cool the joint. When you cool the joint, you shrink the blood vessels. And by shrinking the blood vessels, when they get smaller, it's harder for the white blood cells to escape. You have less swelling, therefore, the tissue around it, less chemicals released into the joint space, and less aches and pains overall. It also affects the nerves. Because when the nerves get cold, they stop sensing pain, and that influences, of course, the way your body will sense whatever's going on down there. So I'm going to try this out. Debbie is here to help. How are you, Debbie? Thank you very much for being with us. So, now, I'm told that you've actually tried cryogenic therapy before.
Yes, I've done it 4 times.
4 times?
Yes.
So I want you to get in, if you don't mind, the cryo sauna. And we're going to try this out. Debbie's agreed to do it for us on their stage for the first time. We're going to see if it makes sense. So the door's open like this, I guess. There it goes. Okay. Now, normally, you only wear your socks in here. But because this is a nationally televised program, I'm going to grab, without looking at her gown. There she is. Da-da-da. There we are. And we got it there. Perfect. All right, now, the treatment takes... Oh, here we are. Treatment takes about 2.5 minutes. But I, of course, want to see Debbie's head before I start. So I'm going to lift her up. I'm starting it up now. There's... I see hands. It's a start. I see hands. There she is. You ever get scared in there?
Not anymore. Okay. I was
so
the first
what
time.
this device does is it rapidly pushes out. Good enough? Okay. So it rapidly pushes out a cold gas. And while Debbie's in the cryo sauna, I'm going to move on. We're going to come back again. It takes 2.5 minutes. You're going to keep your hands up like that?
Yes.
Okay. Everyone ready?
Yep.
Oh, I can see the gas coming out. It's chilly in there, I bet.
It gets really cold. It's cold like if you went out in the snow naked.
All right, so that's the metaphor, out in the snow naked. Go back and talk a little bit about what's going on with Debbie. All right, let's cover her up. Ta-da! There we are.
I don't know if I can get down it.
Oh, it didn't put you down. There we are. She's disappearing. Coming back down. How do you feel, Debbie? Oh,
I feel great.
She's still with us. I'm glad about that. All right, let's just see. There we are.
Thank you.
Looks good.
I feel really good.
So, it's not too cold.
No.
It must be a little cold when you get in there.
It's really cold for a couple minutes. And when you come out, when it stops, everything's hot. I mean, your skin tingles and you feel hot. And really, really good. I feel energetic and good. So
what we like to do on the show is spread the word, right? When we hear about things that other people in other parts of the world use, we want to bring them here. So this is actually used in Europe quite frequently, and it's been used there for many years. And now it's available in the United States in many spas and in some medical practices. It costs about $75 to $100. So it's not a crazy expensive therapy. Number of treatments that you may require, can vary, but I think it's a sensible thing to try out if you're having a lot of pain. Make sense, everybody? Debbie, thank you very much.
Thank you.
And thanks for Celeste as well. Be right back.